I'm going to be discussing basal body temperature and ovulation and how you can make sure that you're tracking your ovulation properly, okay? So when it comes to basal body temperature, there is a follicle, right? Which our follicles are our eggs. And there is one dominant follicle. Over time, it will produce estrogen. Eventually, it will produce enough estrogen so that it will peak ovulation. So then luteinizing hormone is created, and that is what peaks ovulation. And then the corpus luteum in our ovary will produce progesterone, and that's when you have a rise in your basal body temperature. So the best thing to do is take your temperature every morning at the same time. And whenever you notice an increase in your temperature, about 0.4 to 0.8, that shows that you already ovulated, okay? So then you also want to pair that with cervical mucus. So whenever you have an egg white consistency, that means that you are fertile. You tend to get an egg white consistency about 3 to 4 days before you ovulate. So then you know, okay, it's time to have intercourse about every other day. The basal body temperature will be increased for about 10 to 14 days after ovulation. So once you pair that with cervical mucus, you can also do LH or ovulation test strips. So whenever the test strip shows, there's different ways. So it'll either say ovulation, or you'll have a smiley face, or there's a control line. And whenever it matches the test line, then you know that you will ovulate in about 24 to 36 hours. And then again, you want to have sex either that night or every other day. And it's best to have sex about 24 hours before you ovulate, because you want that sperm waiting for the egg.